Hello, welcome to news tutorial presented by DSC SchrDbb. In this tutorial, we are going to see diabetes mellitus. Okay, so to visualize diabetes mellitus, you are going to use the DSC SchrDbb algorithm. Okay, so in the DSC SchrDbb algorithm, you are going to visualize the disease, the differential diagnosis of diabetes mellitus, the endemic disease. You're going to visualize the cause. You're going to visualize the complication. You're going to visualize the background, and then lastly, you're going to visualize the prognosis. Okay, so now this diagram is going to correspond to another diagram, which is for the disease. You're going to have the mechanism. You're going to study the mechanism. For the cause, you're going to study the pathogenesis. For the background, we're going to study the risk factors. For the complications, you're going to visualize the pathophysiology. And lastly, you have the follow-up. Okay, so now where do we start with? You're going to start first with the risk factors of diabetes mellitus. Now you need to point out the fact that in order for you to visualize the risk factors inside your history, you need to go inside your identification. From your identification, you have the age and you have the job of the patient. The identification, the age can be old age and the job can be sedentary lifestyle, and that's where you have your risk factor, your first risk factor. Next risk factor, you go and take it from the past history. So in the past history, you can have risk factors like hypertension, all that. So now that's why you're going to need now to know the risk factors of diabetes mellitus. Now the risk factors of diabetes mellitus is divided into two. We have traditional risk factors, and then we have so the risk factors first are divided into the two types of diabetes, because you have type 2 diabetes and you have type 1 diabetes. So this is for type 2 diabetes. Type 2 diabetes is into traditional risk factors, and you have risk factors related to the metabolic syndrome, or the syndrome X, or the insulin resistance syndrome. So those are the different names of the metabolic syndrome. Now the next one, now you have risk factors now for type 1 diabetes that I'm going to discuss later. Now we start with the traditional risk factors. You need to know that the traditional risk factor is made up of a tetrad. Is it clear? There are tetrad, four things that are involved in traditional risk factor. The first one is the age. So the age of greater than 50 years to 60 years is going to be risk factors for diabetes. The second one is obesity. So when somebody has a BMI of greater than 30, it's a risk factor of diabetes. The third one after obesity is sedentary family issue first. So you have family issue, like in case of genetics. And then the fourth one is sedentary lifestyle. So those are the different etiologies that you can, the different traditional risk factors of diabetes. Now, what are the risk factors now related to metabolic syndrome? The metabolic syndrome is made up of 5 elements, a pentad of 5 elements. The first element in metabolic syndrome is from physical examination, which is central obesity. And central obesity is when you have an abdominal circumference of greater than 89 centimeters in females and 99 centimeters in males. Is it clear? So that is the first one, central obesity. The second one on physical examination still is hypertension. Is it clear? So you have a patient that is hypertensive, it is also a risk factor of diabetes. You have hypertension. The next one after hypertension, the third element of the metabolic syndrome, or the syndrome X, or the insulin resistance syndrome, is glucose intolerance or hyperglycemia. So you have hyperglycemia from glucose intolerance, or insulin resistance. Is it clear? From glucose intolerance or insulin resistance. So After that, the fourth element, after hyperglycemia, the fourth element, the metabolic syndrome, is going to be dyslipidemia. When you have dyslipidemia, is the fourth element in metabolic syndrome. And then the last element, which is the fifth element, is a hyperuricemia. Is it clear? So those are the different elements which are involved in metabolic syndrome. So when somebody have most of these elements in metabolic syndrome, it's also risk factors for him to have diabetes. So those are the different risk factors. Now, correlating history are usually taken. You need to know that you can take out the age from your identification, take out obesity from your physical examination, you take out the family history, take out the family history from the family past history of the patient, sedentary lifestyle from your identification by asking the job of the patient in the nasomat. You have the metabolic syndrome, central obesity taken from the physical examination, hypertension taken from physical examination, or the past history of hypertension. And then the next one is hyperglycemia. You can do it from physical examination, or you have the dyslipidemia. Dyslipidemia, you can assess now the dyslipidemia by seeing elements on physical examination. So how can you visualize dyslipidemia on physical examination? On physical examination, you can see xanthelasma. Is it clear? Xanthelasma are plaques which are located at the level of the eyelids. Is it clear? We have yellowish plates located at the level of the eyelids. They are xanthelasma. And still for dyslipidemia, you can see xanthomata. Is it clear? You can see xanthomata. It is like this, xanthomata. So xanthomata are the different, in case of xanthomata now, you are going to have plaques located at the level of the tendon, the level of the tendon. That's xanthomata. Now, on the next one now, you have the risk factors of type 2 diabetes. Now, you need to know that with type 2 diabetes, though it has some genetic proportion, it is less genetic as compared to type 1 diabetes. Are you getting? Type 2 diabetes is genetic, but it is less genetic than type 1 diabetes. We are finished with type 2. Now it's type 1 diabetes. It's less genetic than type 2 diabetes. Is it clear? So that's the point that you have to note. So though the children are going to have the type 1 diabetes as from young age, is it clear? But they mostly acquire it from something. So where do they usually acquire it? It can be genetic and acquired, but it is something like 30% which is genetic and the other 70% is acquired. But now in the case of diabetes mellitus, something like 60% is genetic, another 40% is acquired. Is it clear? Now, now in the case of type 1 diabetes, where you have acquired, it is acquired from what? Usually from infections. Is it clear? And which type of infections? You have viral infections. Example of the viral infection, you have Epstein-Barr virus. And then when the Epstein-Barr virus infects the beta cells, is it clear? When the Epstein-Barr virus infects the beta cells, what happens is that you are going to have, when the Epstein-Barr virus infects the beta cells, you are going to have auto antibodies that are going to be produced. Is it clear? And those auto antibodies are the HLA antibodies. Is it clear? And those HLA antibodies are going to target the beta cells and destroy the beta cells in order for it to have reduced insulin production. So that's the main difference now between type 1 and type 2 diabetes. In type 1 diabetes, we have no insulin production, while in type 2 diabetes, at the beginning you have insulin resistance, but at the end, when there is a pancreatic crash due to effort of overproduction of insulin in order to stimulate the receptors, you have now a pancreatic crash where no insulin is produced. So that's the summary for the risk factors of diabetes. Thank you.